Hello everyone, welcome back to Dentistry Made Easy. The topic that we are going to discuss about in today's video is compartment syndrome. Also at the end of this video, I am going to mention about the Neet MDS 2023 question which was asked from this particular topic, and if you watch this video properly till the end, you will be able to answer that question very easily. Starting with the topic, firstly, to know what this syndrome is, you should know what you mean by compartment. So compartment basically is nothing but it is the section of the body that contains muscles, blood vessels and nerves, and they are covered by a fibrous connective tissue layer which is known as fascia. So this fascia, it is inelastic in nature and due to which it cannot expand much. So now compartment syndrome is when there is increase in the pressure within this compartment. Over here, this is the normal picture for the compartment and this is the compartment syndrome. As I said, there will be increase in the pressure due to any reason. So the reasons for the compartment syndrome we are going to see later in the video. So any of that reason can increase the pressure, due to which there will be compromised blood flow and that will lead to tissue damage, which will be due to hypoxia and ischemia. So now if there is increase in the pressure, so the vessels which are present inside this compartment, they are going to get compressed. Due to the compression, the blood flow is going to get compromised. Now as the blood flow is going to get compromised, so the tissue won't get proper nutrients and due to which there will be damage to the tissue. Now this compartment syndrome, it is a true orthopedic emergency. It commonly affects the legs and the forearm. So we are just going to see what this compartment looks like in the cross section of the lower leg and the forearm. This fibula and tibia bone, they are going to divide the lower leg into 4 compartments. The blue one is a superficial posterior compartment. The red one is the deep posterior compartment. Yellow one, it is the anterior compartment, and the green one over here is the lateral compartment. Now each of this compartment, it contains muscles and the neurovascular bundle, that is your arteries, veins and nerves, which are going to supply this muscles the proper nutrient. So in the forearm, there is this radius and the ulna bone which is going to divide the compartments into the superficial and deep volar compartment. Next is the dorsal compartment, and there's one more compartment which is known as Henry's mobile ward compartment. So these are the compartments of the forearm. Now compartment syndrome is when there is increase in the pressure. So that increase in the pressure, it can be in single compartment or in all compartments. Now as we said, fascia, it is inelastic in nature. Now if there is increase in the volume or if there is decrease in the volume capacity, which will in turn lead to increase in the pressure in the compartment. By this increase in pressure, the structures, they are going to get compressed. So the first structure to get compressed are the veins. The next structure to get compressed, they are the arteries. Now if your arteries, they are getting compressed, so that will obstruct the normal blood flow, which in turn will reduce the oxygen supply to the tissue, which will lead to hypoxia. So that hypoxia will lead to the cells releasing histamine and nitrous oxide, due to which the capillaries will start leaking, causing extracellular edema. that extracellular edema, it will increase the pressure more. So over here in this cycle, compartment syndrome leading to hypoxia, hypoxia leads to edema. So hypoxia in the muscle cells, it prevents the mitochondria to produce ATPs. Now we know ATPs, they are the energy source and they are required by the sodium potassium pump to take out the sodium out of the cell and potassium inside the cell. Now if your ATPs are less, why? Because there is hypoxia and the mitochondria, they are not going to produce the ATPs. That will lead to, so the sodium, it will be present inside the cell only and it won't go out of the cell, due to which there will be increase in the intracellular sodium. So because of that, water, it will move into the cell, which in turn leads to intracellular edema. If it is persisting for a longer time, it may lead to cell rupture, and that will make the protein to leak into the extracellular space. This is nothing but the complete vicious cycle which happens. Now this compartment syndrome, it is of two types. So it is the acute type of compartment syndrome or chronic type of compartment syndrome. So acute type of compartment syndrome, it is caused by fractures. Other reason can be hemorrhage, crush injuries, or if there is some penetrating trauma, punctures, severe circumferential burns, drug injection, or if the cast. So we know after fracture your leg have that cast. So if your cast, it is not fitted properly, or if it is tightly fitted, so that can also lead to acute type of compartment syndrome. So in this acute compartment syndrome, there is rapid signs and symptoms progression. Now chronic is, it can be due to repetitive use of your muscles. There is exertion because of vigorous exercise, and this chronic, it commonly affects the leg. In this, now the muscle size, it increases due to chronic use of it, due to which there will be increase in the pressure. So there will be fluid exudation into the interstitial space, due to which the blood flow, it gets compromised. Now in this chronic type of compartment syndrome, it occurs during the physical activity and it subsides as soon as the activity stops. Now next we are going to see the etiological factors for the compartment syndrome. So the most common cause for compartment syndrome is if there is bleeding inside the compartment. Now we have seen what your compartment means. So now if there is bleeding inside the compartment, it will lead to compartment syndrome. So this bleeding, it can be due to long bone fractures. So it can be due to fractures, if there is a fracture of the bone. How this mechanism for your fracture is, in fracture there is hemorrhage, there is edema. Due to this, there will be increase in the pressure within the compartment, due to which the arteries, they are going to get collapsed and there will be reduced blood flow. Now the next reason can be penetrating injury. It is going to lead to bleeding into the compartment. Next etiological factor can be the burns. So if there are thermal or the circumferential burns, because this burns, they are going to lead to the tissue edema. Next can be the surgical procedures, that is going to injure the blood vessels. Other causes for the compartment syndrome can be if there is excessive use of any IV drug injections, if there is repetitive use of the injured muscles like we have seen for the chronic one. So the other reasons can be tetanus, where the muscles, it get fatigued or contracted. Other can be seizures. Then there is crush injuries, if the cast, they are not placed properly, if there is excessive limb compression, tight dressings, and also it is seen in the patient who are on anticoagulants, or if the patient have a high risk of bleeding like in hemophilia. So these all are the different etiological factors for compartment syndrome. Now what are the signs and symptoms? So the clinical features for the compartment syndrome. Now in this you have to remember the 6 P's. So what the 6 P's are? So the first 2 earliest signs are pain and paresthesia. So pain, it is out of proportion. So the pain out of proportion is the earliest sign that you will see in compartment syndrome, and it is the most common clinical feature. So the pain, it is the sharp and deep type of pain which is going to worsen with passive stretching. Next P is paresthesia. So paresthesia is nothing but it is the abnormal sensation, that is the feeling of pins and needle, and if it is not treated on time, it can lead to anesthesia. Now in this compartment syndrome, the legs or the affected area, it feels swollen and stiff like a piece of wood. The less common clinical symptoms are pulselessness. Now this is why, because now we have already seen if the pressure within the compartment it increases, so your arteries it gets collapsed, due to which the distal arteries they become weak, and because of that you cannot feel that pulse. The next clinical feature can be pallor. So that is nothing but pale skin. Next clinical feature is poikilothermia. That is nothing but inability to regulate the body temperature, and that will be presented as cold feet or cold extremities. Last extreme type of clinical feature that is very less commonly seen is the paralysis. Now this paralysis is very rare. It is seen when there is extensive damage of the muscles and the nerves. So these are the clinical features. So now what are the complications? First complication can be necrosis. Now necrosis, it occurs when the normal blood flow it is not established on time, which will lead to tissue death due to lack of oxygen. So the next complication can be Volkmann contracture. Now this is nothing but it is the necrosis of the flexor muscle of the forearm, which is going to lead to the fibrosis and the shortening, which results in the permanent flexion. So the third complication is the rhabdomyolysis. This rhabdomyolysis is nothing but it is the muscle breakdown or destruction which leads to scarring of the muscle and the contracture. Over here in this complication you will see that the muscle protein like creatine kinase and myoglobin, it is going to get released from the destroyed muscle cells into the bloodstream. So these proteins they are going to get filtered out by the kidneys, but now these proteins they are very toxic for the kidney, which in turn leads to acute renal failure. And the last complication is it can lead to permanent nerve damage. To diagnose it, so first will be the physical examination. So the muscles they are going to feel stiff, firm, and they feels hard like wood, as we have seen for the clinical features, and the pain it is going to get worsened with the passive stretching of the muscles. Now the best tools for the investigation is the intracompartmental pressure monitor, which are known as the handheld manometers. So they are directly inserted into the compartment. So in this you will see that the pressure is more than 30 millimeters mercury, or it can be if the delta pressure is less than 30 millimeter mercury. So delta pressure is nothing but it is the diastolic pressure minus the compartment pressure. So this is the best tool to see the compartment syndrome. See that there will be more of the creatine kinase and the myoglobin, and in urine you will see that the urine it is a tea colored urine due to high levels of myoglobin. Now the next investigation can be done by the help of imaging, where you take the radiographs, CT scans, MRI, ultrasound to locate whatever the injuries are, and even in the lab test you will see there will be increase in the number of WBCs, increase in the number of erythrocyte sedimentation rate in the case of infections. So if the reason for it is infection, so you can see that in your blood reports. Last part of it is the management. Now we have seen so much of the compartment syndrome. Now how are you going to manage it? So the first procedure is the surgical procedure, which is known as fasciotomy. Now what is this fasciotomy? So now we know that we have a layer of fascia, and due to this fascia only, the pressure, it is not getting relieved. So what we do in this is we relieve the pressure by just cutting the fascia, and then we re-establish the flow of the blood, and it can be left open for few days. So this is nothing but fasciotomy. So now the arteries and the veins, they were compressed. Now as soon as you relieve or you cut this fascia, so the pressure is going to get relieved, the pressure is going to get decreased, and by that the blood flow, it gets back to normal. Now if it is caused by some external factors, like we have seen that if the cast, they are ill-fitting cast, so in that case you can just remove that etiological factor and it will spontaneously recover. Now if the limb is necrosed, if the complication has occurred, so in that case you need to go for limb amputation and you need to go for hyperbaric oxygen. You can also give the patient mannitol diuretics to create that diuresis so as to flush the kidneys. You can give morphine to the patients who have the bleeding disorders. Antibiotics can be given in the case of infection. Now if the patient have already got the complication of rhabdomyolysis, so in that, now if there is renal failure, so in that case you need to go for dialysis. And the next can be bladder catheterization can be done. So all the treatment, it usually depends on what exactly has happened. But the main management is the fasciotomy that you need to remember for the compartment syndrome. So this was all about the compartment syndrome. Now lastly, as I said, I'm going to mention about the question that was asked. So the question was asked as, so they have given this diagram over here and they have given these options. So now you know what the correct answer to this question is. So you can just comment down the answer to this like in the comment section below. And I hope you found this video helpful, and if you did, then please like, comment, share and do subscribe to my channel. Thank you so much.